Hi there, you must be Serena.
Hi, nice to meet you.
Hi, I'm Jawara, your kinesiologist for today.
Can you tell me what kinesiologists do?
Oh, great. So essentially, a kinesiologist is someone who prescribes exercise protocols and prescriptions to people of clinical backgrounds, athletic backgrounds, pretty much anybody, in the sense that we get you guys active to improve your function, your mobility, or your performance in your everyday lives.
Very cool.
So what brings you here today?
Well, recently I retired. I used to be a teacher at a high school, and I heard that exercise is beneficial for maintaining a healthy, active living.
It is, yes.
And more importantly, I'd like to be more active with my grandchildren.
Oh, great. You have grandchildren.
Yeah, I have 3 grandchildren.
Right. So, Serena, I see here you've been referred to by your family doctor, Dr. Marcel from Woburn Medical Center about
Yep.
3 weeks ago.
Yep.
Regarding your hip fracture and your osteoarthritis.
Yep.
Can you briefly tell me about that?
So basically, I took a fall down the flight of stairs in my home, and I suffered a left hip fracture. Recently, for that, I had orthopedic surgery, so a hip replacement, and I've also been in a lot of pain throughout the recovery process. It hurts to sit down and stand up from a seated position.
Right.
And added to this, I also have osteoarthritis. And because of all these health complications, it stops me from doing simple activities like cleaning my house or driving or even playing with my grandchildren, which is the most important thing to me.
Okay, so on a scale of like 1 to 10, how bad is your pain?
About 7.5 out of 10
Really? Wow.
Yeah.
Like when you like which positions?
in the seated position, and when I get up from the seated position.
Okay. We're now ready to fill out the Get Active questionnaire,
Okay.
which basically assesses your readiness to partake in exercise. Would that be okay?
Yep.
Sure. So here's the questionnaire. So it starts off with simple questions and just asking you about your history, things of that nature. So we'll go through it together.
Okay.
Sure. Have you ever experienced a diagnosis or treatment for heart disease or stroke, pain or discomfort and pressure in your chest area during physical activity?
Nope.
Do you currently have pain or swelling in any part of your body from an injury, arthritis, back pain? I know you mentioned your osteoarthritis,
Yeah.
so that should be a yes.
Yeah.
Has a healthcare provider ever told you that you should avoid or modify a certain type of physical activity?
Yeah.
Yes.
Yeah.
Last question, do you have any other medical or physical conditions such as diabetes, cancer, osteoporosis? You have osteoarthritis, so I assume
Yeah.
that's a yes as well.
Yeah.
Now we're going to assess your current physical activity. During any typical week, I know you mentioned you like to bowl,
Yeah.
right? How many days do you partake in moderate to vigorous exercise?
Now, recently, brisk walking, I try to do that 3 times per week.
Okay, perfect. And in bouts of about how many minutes per?
About 20 to 30 minutes.
20 to 30, that range is about 60 minutes to an hour and a half of exercise per week.
Mm-hmm.
It's a bit short of what is expected, especially for a senior of your age. You're expected 150 minutes per day of moderate to vigorous activity. So hopefully once we get to the flow of rehabilitating your osteoarthritis and your hip injury, hopefully you can get to that stage where you're exercising a lot more actively, safely, without pain.
Okay, perfect.
Have you consulted a healthcare provider who has recommended that you become more physically active?
Yes.
Perfect. I'll need your electronic signature and just brief information filling that out, please.
Okay.
Perfect, thank you. I'll have this printed off. Okay, Serena, now that we've gone through your health history and your readiness to exercise with the Get Active questionnaire, based on my notes, I understand that your main goal is to improve your hip mobility to get back into healthy activities such as the bowling, the hikes, playing with your grandchildren.
Mm-hmm.
So we're going to get into something called SMART goals, which is an acronym for specific, measurable, attainable, realistic, and time-oriented goals.
Okay.
So from this, in terms of specificity, I understand that you want to functionally perform activities of daily living such as sitting and getting up out of a chair, pain-free. You also want to improve your hip flexion, also pain-free, and also hang out and exercise with your grandchildren.
Yeah.
Correct? Perfect. Okay, so in terms of how we measure your goal, Dr. Marcel from Woburn Medical Center, he assessed you to have more than 90 degrees of hip flexion when you get into a squat position, which is not essentially the typical measurement for seniors or people of your age.
Okay.
So we're going to try to improve that. And also as well, you mentioned that your pain of 7.5 out of 10 We're going to try to reduce that too. In terms of attainability, we want to achieve this goal by your adherence to a daily exercise intervention that you'll be doing twice a day, once in the morning and once at night is probably the best way for you to accomplish this. In terms of how realistic the goal might be, we want to focus on the domains of improving your hip function and alleviating pain in your hip mobility. And we're also going to want to emphasize rehabilitating your left hip before proceeding with a difficult task. And in terms of time orientation, this exercise program will be every day, twice a day for 8 weeks. We're going to check in after 4 weeks and after 8 weeks.
Okay.
And we're also going to have a brief discussion via email or phone every week, just describing your progress on. All right, Serena, now that we've gone through your SMART goals, I can explain you the basis of your exercise intervention.
Yeah. What exactly would be the nature of that exercise intervention? Like, what does it entail?
That's a great question. It just typically involves exercises in which you'll be using your body weight to work on your hip flexion and your hip mobility. So in detail, so the first exercise, which would be the alternating knee extension in a seated position. So you're going to be seated. You want to slowly elevate your left knee and straighten your leg, and just slowly release it back down to the floor.
Okay.
You're going to want to do that for 2 sets for 10 reps per set.
Okay.
And you want to hold at the top for 3 seconds. We'll get into all this later in detail, but that's just the basis of it. So that's the first one. The second exercise would be a knee raise with hip circumduction. So it's kind of the same thing in a seated position. You're going to raise your leg, and you're going to make small little circles with your leg, really getting the mobility in your hip to move around in circular motion.
Okay.
That also would be 2 sets, 10 reps a side, also at a low intensity. And a slow, controlled pace, nothing too fast.
Okay.
The third one would be standing step overs. So you're going to be standing up against a wall. There's going to be a low barrier, and you have to step over that with your leg and right back, really getting your hip into a flexion, really working on that. The fourth exercise would be a modified reverse lunge. So you'd be holding onto a chair. Your left leg would be in front, with your right one in behind, to really emphasize the hip flexion as well, but using the chair as well to scaffold your ability to get into that position.
Okay.
And finally, the last one would be a modified squat, in which you're holding onto the chair as well, just to get down to that deep position comfortably and safely. Does that seem something you feel comfortable with?
Yeah, absolutely. But I just have a couple of questions. What would be the expected benefits of this exercise intervention?
Well, primarily, this exercise intervention will improve your hip mobility and also your ability to perform tasks of daily living, and also to combat your osteoarthritis. Weight-bearing activities are a great way of strengthening your muscles and your bones as well, so that could be of benefit to you.
Okay, what about the risks of the intervention?
Okay, so because the 5 exercises, as explained, only deal with your body weight, there's a low chance of risk.
Okay.
However, if you overdo the exercises, or if you're incapable of understanding when you're in pain or in discomfort, that might be a sign of risk. But the activities are very simple, and they're not dangerous at all. So it just depends on how well you can perform them correctly and safely would determine that. But we'll go through all that later on.
Okay.
So
what about side effects when I'm performing the intervention? Like, what does that entail?
Right, so since you haven't necessarily been quite active over the last couple months or so, a common side effect you may encounter would be muscle soreness, but that's very, very mild. It would probably go away within a matter of a day or two.
Okay.
But other than that, there aren't many side effects, or there aren't any side effects really that are incorporated with the exercise treatment.
What if the intervention doesn't work? Like, are there any other alternative courses of action? Like, can you prescribe medication or give me any injections?
That's a good question. Unfortunately, as a registered kinesiologist, I'm not permitted to administer any controlled acts, so I couldn't inject anything.
Okay, what is a controlled act exactly?
So essentially, a controlled act is any healthcare act that is administered by an unqualified individual that could potentially cause harm.
Okay.
So I'm not, it's not in my scope of practice to administer injections or prescribe medications. But if there's an issue with an intervention, you could always come back, so we can modify the exercise protocol to fit your benefits and your needs as well. Because at the end of the day, I'm here to support you and enhance your mobility. So.
What are the consequences if I don't participate in this intervention?
If you don't adhere to the prescribed exercises, and you maintain a sedentary or an inactive lifestyle, these things may worsen.
Okay.
Right.
Okay.
So do you feel comfortable with these, with the aforementioned details of the exercise, and do you have any further questions, or are you ready to?
No, you clearly outlined everything that I had questions about, so sounds good to me.
Right, so here's the consent form, just look over that. Whenever you're ready, take your time, read it, the detail. I'm here to ask any questions.
Before I fill this out, can you just tell me what consent is?
Sure, so informed consent means that the person, the client, must receive information about the service matters in order to make an appropriate decision regarding the treatment. So it's important for me as a kinesiologist to obtain informed consent from all my patients to uphold the standards of safety and professionalism to protect the public interest. For you, the client, informed consent is necessary to understand all the ins and outs about what the treatment entails. You must have the capacity to understand the information relevant to making a healthcare decision. You must appreciate the consequences regarded in the decision or the lack of decision and how it affects your health. And also, you have to have the ability to justify your decision as a patient. So Serena, if you look at the very bottom of that form, it asks for your consent to disclose personal health information. Do you see that?
Yeah.
So what that basically highlights is your agreement to have your personal health information about your osteoarthritis, about your hip fracture, to be shared with other health members, whether it be a doctor or a physiotherapist, if in the event that you are referred to another health professional for your services. So do you agree with that as well?
Yeah.
Perfect. Thank you. So now we'll get on to your health history.
Okay.
Do you have any history of chronic diseases in your family?
No.
That's very good to hear. Are there any other injuries that I need to consider before we begin?
Just other than my osteoarthritis and my hip fracture and my hip replacement, I've sustained no other injuries.
Great. Were you previously healthy before? Active in that
Yeah, I
direction?
used to be an avid bowler, but due to all of my health complications now, I just try to take brisk walks about 3 times a week.
Great. All right, Serena, so now that you've consented to the exercise prescription, now it's time for me to teach you the exercises so you can do them at home. So are you ready for that?
Yep.
All right, so for the first one, it will be an alternating leg extension. So I want
Okay.
you to extend at the knee and
Okay.
straighten your leg.
Okay.
Nice and slow. Hold it at the top for 3 seconds. And then slowly on the way down. How did that feel? Is that comfortable?
It's manageable, yeah.
Right? All right, so you want to be doing the same exercise for both legs. 10 reps each side, twice in the morning, twice at night. Is that okay?
Yep.
All right, so for the second one, it's similar to the first. I want you to raise your leg as well. Now I want you to lock at the knee, but I want you to make a circular movement at the hip. Does that make sense? Just as such, a little bit slower, right? And then slowly back down. So 3 circles, slowly back down.
Okay.
So 10 on the left, 10 on the right, 2 sets, twice in the morning, twice at night.
Okay.
Understood?
Yep.
Right? All right, Serena, so now we're doing standing step overs. So I want you to step onto the platform with your left foot
Okay.
and slowly step back down. How does that feel? Is that okay?
Yeah, it's good.
Good? All right, Serena, so these last 2 exercises involve a chair for support, so you're gonna hold on to that.
Okay.
So the first one is a modified back lunge. So with
Okay.
your left foot forward, I want you to step back with your right foot.
Okay.
Go as deep as you can. And the last one, also with the chair, you want to do a modified squat.
Okay.
So just get as deep as you can without any pain or discomfort,
Okay.
with your legs straight and aligned. How's that? All right, Serena, so that kind of concludes the exercise protocol that you be performing. Do you have anything to say, any concerns, questions?
I really appreciate what you've done with me today. I think all of the exercises were manageable, and I think I'd be able to complete them successfully, hopefully. And I'm really optimistic that it would help me engage with my grandchildren and do my daily activities of living without pain.
That's great, that's great. And I'd also want to follow up every month, so once after the 4th week and once after the 8th week, to
Okay.
just see how things are going.
Okay.
All right, do you have any other comments or things to say? No?
No, that's fine.
All right, perfect.
All right.
It was a pleasure to meet you, Serena.
Thank you so
I'll
much.
keep in touch, okay?
Thanks.
Great.